Morning.
Good morning. How are you?
Morning. Morning.
Morning.
Hey, good morning, Chris. Welcome.
Good morning. Thank you. Morning, everybody.
Got the view back there.
Yeah. Don't let, it's a little deceiving. I'm the only one here.
Well, it's much more dramatic than mine, I will say. Trust it.
Morning. So I'm just listening to Chris and Denise. You both sound, your audio sounds good.
We're good? Good, thank you.
Yeah, I hope I got this Zoom thing down at this point, but you never know.
I know.
I got a couple different cameras, so I had to make sure I was on the right one.
Mhm.
And they're always making changes at the last minute.
No, only when we're planning an event. That's the only time.
Of course.
We're just waiting for Dr. Choi, I see, right? There he is. Good morning, Dr. Choi. Welcome.
Hey, good morning, guys.
You sound loud and clear. That's good.
Okay, great.
Yeah, good, strong audio.
Your fellow panelists are here, Denise Henry and Chris Brigham.
Good morning.
Good morning, guys.
Morning.
Glenn? You're
Yes.
dialed from your computer, correct?
Pardon?
You are connected through your computer with audio, right?
Mm-hmm.
Okay. Thank you. Did anybody by chance call in for audio on their phone? No? Okay. It normally gives a phone number. I was trying to give a phone number to someone to connect via audio, but all I can seem to do is give them a link, so.
Tamika, that was Valerie briefly from my office, who's participating. She's gone off camera, but just wanted to.
Oh, no, that's fine.
Yeah.
I'm
All are
back.
welcome.
Good
All are
morning.
Hello.
Tamika, I just sent it to you.
Oh, thank you.
You're welcome.
Good morning.
For those of you who are just joining, we'll be getting started soon.
Good morning, everyone. We'll get started in just one moment.
So for those of us who don't know, could someone clarify, are we going to be fielding questions on the chat box, or will Garrett or someone field those for us?
So during the presentation, during the time that you're speaking, anyone who wants to ask a question can absolutely send questions through the chat. And
Okay,
then there will be a time throughout the program for Q&A. But yes, if you definitely in the moment have a question, please feel free to put your questions in the chat. Thank you very much. And again, we'll get started soon. My name is Tamika Miller. I'm the Vice President of Marketing and Program Development with the Greater New Haven Chamber. And we will get the slides up for you soon, and I will hand it off to Garrett.
Great. Thanks, Tamika. And thanks everyone for joining us. I know we've got a good crowd out there. And as Tamika was just describing, we'll start with our panelists, and then we'll give everyone an opportunity to get involved in the conversation. I have to go to a bus stop at some point. So if you see my screen go black, I'm still there and still asking questions, but apologize, just part of the morning life. So again, thank you for joining us for COVID-19 vaccinations, what employees and employers need to know. This program is presented by many of our councils today. So we've brought together 3 of our councils: the Human Resource Council, presented by Carmody; our Healthcare and Life Sciences Council, presented by Harvard Pilgrim Healthcare; and our Nonprofit Resource Council, presented by Whittlesey. All of our programming over the last several months, we've been supported by Connecticut Natural Gas, Southern Connecticut Gas, and UI. And also, you'll see on your screen now, as we scroll through all of our investors, these investors have been with us throughout the last year and have allowed us to be able to put on the programming that we've had for you going through many months. And many of our guests are repeat guests as well, but that's because they've been great speakers for us. And so as we get into this conversation now of COVID-19 vaccinations, what the employees, what your employers need to know, I want to welcome in our panel that we have with us this morning. We have Denise Henry, she's the CEO at Sarah. We have Dr. Stephen Choi, who is the Chief Quality Officer at Yale New Haven Health, and we've had Dr. Choi a few times now. And we're also joined by Chris Brigham, who's a shareholder with Updike, Kelly, and Spellacy, and also chairman of their employment practices group. So thank you all 3, and we'll make sure we spotlight their screens as they're speaking, because I know if you're on the gallery view, you can see everyone. But I want to start with Dr. Choi. And Dr. Choi, good morning. Thanks for being with us once again. Why don't you start by just telling us where we're at with the vaccine rollout? It seems like things are generally going well in Connecticut, but people are just starting, especially once we hit April 5th, to have a new wave of people who will begin to enroll.
sure. Well, first of all, thank you, Garrett, for inviting me back to this forum. It's always been a pleasure to join you and the team here. And thank you all for taking the time to log in. So I'll start with some data that I think many folks will want to hear, and we'll start with some numbers of how many vaccines we're administering across the country, and then I'll sort of focus on Connecticut. So across the US, the latest daily moving average, and what that does is they take the last 7 days and they average it out. We're well above 2 million doses a day administered in the US, and that's nothing short of a miracle. And as of today, we have over 125 million individuals in the US who've received at least 1 dose, and that includes the Johnson & Johnson dose, which would render you fully vaccinated, at least for the time period. And our country has about 27% of its population vaccinated, and about 14% of those are fully vaccinated. Again, it would include the J&J dose or the 2 doses for Moderna and Pfizer. In the state of Connecticut, we have 30% of the residents in Connecticut that have received at least 1 dose, and approximately 16% who are fully vaccinated. And to give you a scale of how that compares to both other states and countries, there are some states that are up as high as 30-40%, and then some states that are still struggling. And then there are nations who are very well vaccinated. The UK took a unique approach. Rather than trying to get everyone fully vaccinated, they gave everyone at least, or as many people, 1 dose, and so they're up to 42% versus the US average, which is about 30%. And then there are some nations like Israel that are just doing a phenomenal job. They've got over half of their population fully vaccinated. And what these numbers mean now in terms of the daily administration and what we're projecting for the summer is that roughly around the beginning of summer, towards the end of June, at this rate, we think we'll have about 70% of the US population vaccinated. And for those of you who read up on herd immunity, you know anywhere from 70 to 90% is the number we really want to hit in terms of just establishing herd immunity in the US. So those are all good numbers, Garrett. So I'm very pleased to see that this is the trajectory we've been taking for the last several months.
Great. And from what you've seen, people are able to take the vaccine, not having any serious issues or side effects. And have people generally been willing to take the vaccine?
Yes, with exceptions. So, you know, we've seen anywhere from 30 to 40% of individuals turn down the vaccine for whatever reason. I think it stems from historical biases towards disparate groups in our country. It also stems from lack of trust and skepticism about the way the vaccines were studied and approved. And there are certain populations that are concerned, you know, particularly young women who are of childbearing age or young women who are actually pregnant or trying to get pregnant. And those are the groups that we have struggled with in terms of reaching them for acceptance and for getting the vaccine. But in general, I think the population here in the state, as well as across the U.S., particularly when there was a sense and a sentiment that there was a shortage in supply, you know, many people got in line to get the vaccine. And hopefully those numbers will continue to increase. I think the uptake, you know, started as low as, you know, high 50s, and now it's well into the 70s. And we want to get to 100% if possible, of course.
And I'll get to Denise in just a moment, but one more question, Dr. Choi, and we'll come back to you in a few moments. But I have heard people sometimes have side effects right after receiving the vaccine. Can you just describe that? Someone, if they're about to go get a vaccine, what should they expect?
Sure. So we make it a practice to observe our patients who do receive the vaccine for a limited period of time, you know, 15 to 20 minutes, because you can have, although it's rare, you can have what we call an anaphylactic or allergic response to vaccine, but it's very, very rare. The most common side effects, and I had it myself, it was local site pain or swelling. So the site where you get the vaccine, which is in your deltoid or your shoulder muscle. But those subside pretty quickly. There are cases where, you know, patients do feel, you know, kind of like they've got the flu or kind of drowsy or fatigued. And that's actually a good sign. And that's a sign that your body's actually mounting an immune response. And if you remember, the way or the mechanism that the vaccine works is such that when that spike protein is introduced through the RNA or DNA, depending on the vaccine rather, that you get, the body mounts a response where you develop antibodies. And those antibodies are what protects you. It's nothing to do with the vaccine component itself. It's what the vaccine component allows the body to produce, and it's those neutralizing antibodies.
Thanks, Dr. Choi. And we'll come back to you in a couple of moments. Let me turn now to Denise. And Denise, thanks for being part of the program this morning, also for chairing our nonprofit resource council. Why don't you tell us a little bit about what your experience has been with your organization and employees getting the vaccine? Have people been interested in going out and getting the vaccine?
Good morning, Garrett. Good morning, everyone. Thank you for having me here. I'm glad to share our experience. Yeah, so a little bit of a background with SARA Inc. We have approximately 130 employees, and we deliver early intervention services to infants and toddlers. And we also deliver services to adults with intellectual and developmental disabilities. And given the vulnerability of those populations for severe illness or even death as a result of the virus, and the close proximity many of our staff have to work with the people they're supporting, we made the decision here at SARA Inc. to require all our employees, independent contractors, volunteers, as well as interns who may be associated with our organization to get the vaccine. So it is a requirement. We developed a vaccine requirement policy in conjunction with legal counsel. We shared that with our staff in December. That is when the first group of our employees became eligible. They were on the forefront of that because they're considered healthcare workers. So we did a really comprehensive communication plan around that, explaining why we had to do it, educational materials, sharing pictures of staff getting the vaccine when we were able to, partnering with Dr. Reginald Eady from Trinity Health on doing a webinar to educate our staff. I also did a number of staff meetings in person, small ones and virtual, to explain that. So we did make that a requirement. We've given people at this point until September 1 to either be vaccinated, receive the vaccination, or we also, of course, are allowing for medical or religious exemptions. So we have a process for that as well. And at this point, with those first groups that were eligible for the vaccine, we are 84% of our staff having received it. And for that group that just recently became eligible, we're at 45%, but they're only about 2 weeks in. So they're a highly motivated group as well. That's our early intervention staff. I think educating staff, supporting them, hearing their concerns, partnering with them on those, being understanding, giving ample time has helped us with that. We're also requiring that staff who are joining SARA Inc. as new employees receive the vaccine. And we're getting a good response from those people who are onboarding with us. We have not yet heard from anyone who was thinking of joining SARA Inc. as an employee not wanting to get the vaccine, but they haven't shared that with us. So overall, we're doing very well with it. We have several people that are still somewhat reluctant. Again, they have time to think about that. If people do not either get their vaccines or fulfill the exemption process by the date we're looking at, which is September 1, they will be put on unpaid leave until we can work out what we're going to do next. But overall, they've done well. There were some initial issues with getting into the VAM system, the Vaccine Administration Management System, but we worked with them whenever they had issues or concerns. HR was really helpful with that, their supervisors. So there is initially when there's a new rollout of a group of people needing to get the vaccine, there can be some difficulty getting the appointments, but we've seen a staff are focused and motivated with our support they're getting in. And we're also want to be very understanding of the process with staff. So we're paying for them to go, if they have any mileage, we pay for that as well. If they don't feel well after getting the vaccine, we pay for them to stay home and recuperate. Again, we want to be very supportive throughout this process because we realize it's a big ask, but we feel it's incredibly important given the vulnerability of everyone that we support in our staff. So we want to keep everyone healthy. And overall, we're showing good success, which we're very pleased with, that people are understanding and working with us on that.
No, thanks, Denise. That's great to hear, especially that you have so many people vaccinated now. Let me turn now to Chris, and Chris will take in the legal perspective. We just heard about what's happening at Denise's workplace at SARA. What should employers be thinking about? Can they impose restrictions? Like Denise said, obviously Denise is working with certain populations that require that they are able to not be able to pass on COVID, but how about for all the other employers out there?
Yeah, sure. Good morning, Garrett, and thank you for having me. I guess my first words of advice is if you're going to mandate the vaccine, call Denise, because it sounds like her organization is doing it, really well with a lot of sort of pre-planning and the education piece of it. I think it, obviously goes by industry. We're seeing for instance, in the healthcare industry, some of our small medical practices, they're more inclined to mandate than other, companies that don't have, patient contact and things like that. But I think the bottom line is that employers can mandate the vaccine. The EEOC made that pretty clear early on and got out ahead of this. Subject to, as Denise said, those two main exemptions, the medical exemptions and the religious accommodations. So in our world, we work with a lot of small healthcare practices, schools, small private companies. I don't see a whole lot of mandating taking place in the non-healthcare industries that we work with. Even some of the independent schools that we work with are highly recommending or encouraging the vaccine, but not going as far as mandating. And they're seeing those good results, just as the same as some of the others that have chosen to mandate. But the answer is yes, you can mandate. That's the legal answer. The practical answer is, you really need to sort of look at your workforce, look at your industry, and decide, what that mandate is going to do, to company morale, employee morale, things like that. We see a lot of our clients highly encouraging it. One of the big issues, Garrett, that's coming out now is this whole question of incentivizing employees to get the vaccine. So as Denise said, making sure that they're paid time, paying the costs of it. Some of the federal legislation under the new ARPA is making that easier. Because if you remember back to, it's hard to believe that it's been a year since we've been doing these Zoom calls, but one of the first things that we were talking about was the Family First Corona Response Act and compensating employees for paid sick leave and family leave due to COVID. And that was due to expire in December, but now it's been extended on a voluntary basis with a accompanying tax credit through September. So what that's allowing companies to do is with respect to the vaccine is to incentivize their employees to get the vaccine by providing them paid leave to go get the vaccine, even providing paid leave for any sort of after effects if they're feeling ill, taking paid sick leave the next day or two. So we're seeing sort of an increase there in the incentivizing employees to do it by providing paid leave. And that's, the nice thing about that is because of the extension of under ARPA, employers can take, an accompanying tax credit for that compensation paid to employees through September 30th right now.
And Chris, are you getting a lot of questions on a daily basis just regarding vaccines from employers? And do you expect that to change as more and more people come back to work?
Yeah, we're getting a lot of questions, and I think I see that sort of continuing for sure. The main question, as you pointed out, is should we mandate? Should we not mandate? And it's hard to answer that question because, as I said, from a legal perspective, the answer is yes, you can. But from a practical perspective, there's so many individualized, considerations that you want to take into account. But we're seeing a lot of questions on vaccines. We're seeing a lot of questions sort of resurface now on, what do I do about paying my employees? And to be clear, under the Family First Corona Response Act, we didn't even have the vaccine when that came out. So when we were talking about compensating employees for, being sick due to COVID or caring for someone with COVID, now under the new act, the vaccine and ill effects from the vaccine are now specifically, mentioned as reasons to compensate employees for that time, if you choose to.
Thanks. And let me turn back to Dr. Choi. And Dr. Choi, I know one of the questions people are starting to have now that there's more opportunity to get the vaccine, does it matter which vaccine they get? We hear about the 3 that have been approved and at least maybe 2 others that are in the pipeline. What do you tell people as to if they should decide between which one to get?
We've taken a position here at Yale, both at the school and at the health system, that the best vaccine is the one that's in front of you. And by that, I mean, they're all excellent vaccines. There are pros and cons. Just to be specific, Garrett is referring to the J&J vaccine, which was most recently approved for emergency use. And then, of course, the Moderna and the Pfizer, which were approved several months ago. They're incredibly efficacious. I think that the most important thing to keep in mind is that they were all shown to prevent hospitalizations and mortalities from COVID. There's a difference in the panel in terms of which ones and how they prevent COVID altogether, but there's some nuances that people, the general public, does not appreciate, and I think it's important to note that out. And that is that the J&J vaccine, as you know, was trialed most recently compared to Pfizer and Moderna. And both those vaccines, the J&J vaccine was also trialed in South Africa, as well as Brazil, where we have a number of variants circulating, and of course in the UK. And it's shown to be, 80+% effective in terms of any severe forms of those variants. And I think what's important about that is that the Pfizer Moderna vaccine, some background noise here. The Pfizer Moderna The Pfizer and the Moderna vaccines were actually not trialed when those variants were circulating. So that's a small subset of patients that did receive those vaccines relative to the global administration of the vaccines now. So I think they're both excellent. All three of them are excellent. So I would not say there's a preference for any of those. It's really what you have access to. And we stand by that.
Thanks, Dr. Choi. And we'll get to questions in just a moment. Denise, let me ask you one more question. As you've gone through this process with your employees, hey, have you had to counsel anyone? Have you had to have conversations, people who are hesitant? And what have those been like, without divulging any personal situations?
Yes, we have. Our human resources staff are regularly checking in with our employees to see where they are in the process, and those individuals who are not getting into the VAM system or getting themselves scheduled, we are speaking with them, our HR staff as well as their supervisor, speaking with them about how they're feeling about the process, their feedback. And we have several staff who are quite reluctant and are waiting until the timeline is nearer in September. We may be moving that up given how much of the vaccine is out there. And we're being supportive, but we're also being clear on the requirement and why. As I said when I met with all our staff initially after we sent out the new policy, we don't want to lose anyone over this. We don't want them to choose not to stay with Sarah Inc. At the same time, we don't want to lose anyone through severe illness or death. So I know that can sound a little dramatic, but that is what it comes down to, particularly with the services we do. So we hope they'll choose to stay with us. We'll respect their choice if they don't. And we're also highly encouraging them, of course, to speak with their medical provider. Whatever questions, concerns they have, we're not going to answer that. We will help them get resources, but giving them that time and then speaking with their medical provider does really seem to help. And I have to say a good number, I would say, of staff who were initially reluctant have come along over these weeks and months. And we hope to see that be the case for everyone.
Thanks, Denise. All right, let's open it up for questions from the chat. And I do see one that's already there. And if you have not gotten your vaccine yet and do not have an appointment, this is probably the most important one. Everyone trying to understand how you get in through the system. I've definitely heard of people with lots of different strategies, from go to multiple sites, websites, show up at the end of the day at different facilities. Dr. Choi, any advice you can pass along here?
Yeah, I don't know if there's a slam dunk answer to that, Garrett. As you said, there's two mechanisms, or two primary mechanisms that you can do. Is you could go call the various centers that are listed, and perhaps your team could put it on the link here, but it's the ct.gov website, and they'll list all the areas or locations in your area. And certainly you could put multiple areas if you're willing to drive and you have a workplace that's in an area that may have more options, it might be easier to, put in those areas too. And then you can also pick up the phone and call those areas. But that site has, the commercial locations as well as the, medical centers. So you're talking about Walgreens as well as the health centers that are offering vaccinations. And you can actually go on some of those sites onto their own portal where you could, schedule the vaccines yourself. And some of the sites for those who really are insisting on getting, one vaccine over the other, some of those sites actually list what vaccine that they're providing at the time. But yeah, we wish it was a better way to do it, but I think the most important thing is that we're really splitting hairs when we're talking about weeks or even a month or two. We're not talking about people having to wait till next year or till next fall. The majority of those who are eligible will be able to get vaccinated in the upcoming weeks or month or two.
Great, thank you, Dr. Choi. Anyone, please, raise your hand, and if you have a question for anyone on our panel, and we'll give you an opportunity to ask it. You can use the raise hand function, and we'll let you turn that on and ask your question. While we're waiting for folks to do that, and if I don't see you, you can just start talking. But Chris, let me ask you this question. Let's fast forward. We get to a point in time when we do have vaccines readily available. A lot of people have taken them at work. How do you deal with employees who are uncomfortable because other people haven't taken the vaccine? I've already talked to some people who are like, oh, well, if someone hasn't taken the vaccine, I don't want to be around them. How can you envision employers will have to deal with that situation?
Yeah, it's a good question, Garrett. I mean, I think so much has changed in COVID in terms of relaxing or perhaps loosening an employer's ability to inquire about medical conditions, but some of the privacy, dictates still exist. You can't discuss someone else's medical condition with another employee. So the answer is you really can't discuss who's been vaccinated and who has not been vaccinated. You have the right to request proof of vaccination from the employee, but you're required to maintain that confidentially. I had one client who circulated a sign-up list for vaccinations, and so people could pick a slot. They were an employer that was helping manage the employee vaccination program, and they put up a sign-up list and quickly had to take that down because they realized, gee, now people are going to know who's getting vaccinated and who's not. And they had a couple of employees that were choosing not to get vaccinated that complained and said, now people are going to know if I don't sign that list that I'm not getting vaccinated. So you still have to maintain that sort of medical confidentiality. But as Denise said, in terms of working, I think that's going to be the sort of the struggle, so to speak, for employers, is not the medical accommodations, not the religious accommodations, but really just those folks that aren't interested or unwilling for other reasons. And the guidance really is treat them the same way, in a sense. Go through the accommodation process, have a dialogue, try to figure out what they're thinking and what their concerns are, and see if you can work through it. And I again, Denise's experience that you're seeing more and more employees who initially resisted now willing to get the vaccine is, I think, proof that works.
Thanks, Chris. Again, I'll open it up to anyone who wants to ask a question. We did have one question in the chat, but I think that's right around what we were just asking. If you could publish a list to all employees, and Chris just answered that, that is not to be done. Dr. Choi, let me ask you this one. If in this world that we fast forward to, we have vast majority of people taking the vaccine, we reach that herd immunity. Will it be an issue that there are some people that have chosen not to take the vaccine? Will that still be a cause for concern with COVID, understanding that we want as many people as possible to take it to eradicate the virus?
Yeah, so it's a great question, Garrett. And as I mentioned earlier, we want to get, as many people vaccinated simply because the numbers for herd immunity are certainly well north of, 60, 70%. So the concern we have now is that, even if we got 100% of people vaccinated, right now it looks like the trials for children, who represent a significant portion of the population, those probably won't be complete by the summer, maybe late summer, and we may be able to get children vaccinated in the fall or early 22. So you've got to imagine that even if you get 100% of adults vaccinated, there's still a significant portion of the kids, under 16 or 18, depending on the vaccine availability, that won't be vaccinated simply because it's not available. And so as close as we can get to 100%, that's what's most important. And, I don't want to be an alarmist, but we have to take into consideration these emerging variants, right? So the B117 and the 11351 from South Africa and the Brazilian variants, those are concerning. And those were not well studied with the Moderna and Pfizer vaccines.
I might get my gloves on.
So that's an unknown, but we know that's a potential possibility of breakthroughs. So the more we get, the better, of course. And that's not a great answer because that's the obvious answer. But to answer your question, as close as we can get to 100% of those eligible getting the vaccine, the better off we'll be. And I think for those of you on the call, to message something to the employees and for the non-medical healthcare folks is that there's nothing else that we could ask for at this point. There's not going to be a silver bullet. There's not going to be a medication that you can take as a pill or as an injection that's going to diminish or get rid of COVID-19. Like, it's not going to happen. The vaccine is what we're eventually hoping for, 12, 13 months ago. I can't believe it's been that long. We're hoping for the vaccine to get here because we knew that was our best chance at eradicating this pandemic. So it's here. So people who are waiting for something better than a vaccine, I think it's important for us as a medical community to share that there is not going to be something better than an approved, safe, effective vaccine to eliminate the consequences of this virus. So hopefully that helps, Garrett, and hopefully that messaging can be shared with the community.
Dr. Choi, we do have a question. I know this is still under some research, but do the vaccines prevent people from getting the virus and from transmitting it, or do they get it and they just don't feel the effects from it?
Yes and yes. So we know there are breakthroughs in the Moderna and the Pfizer trial. About 5% of those who got the complete series, the 2 doses separated by 3 weeks for Pfizer and 4 weeks for Moderna, were still getting the infection, and therefore were able to transmit it. But none of those patients developed severe illness that required hospitalization, and none of those patients were succumbed and died from it. And very similarly with the J&J vaccine, greater than 70% did not get the virus, but more importantly, none of those patients who actually received the J&J vaccine developed severe illness or were hospitalized or died. And I know people are going to get caught up with, well, I still want the better number, but you got to keep in mind that those vaccines were studied at different times. And we know that the J&J vaccine, both in Brazil and in South Africa, were very, very effective at eliminating any severe form of the variants. And the Moderna and Pfizer were studied when many of those variants were not circulating. So this is where I think people are trying to pick and choose, and it's it's a wasted exercise to do that. I would just get vaccinated because they're all three are very, very effective in terms of preventing the real grave consequences of it.
Denise, let me send a question over to you. Now that you have so many people who have gotten the vaccine, have you had to, there's a certain sense of liberation, I know from talking to people who do get the vaccine. How do you manage that at the office, that people now are starting to let go of maybe some of the precautions that they had in the past?
That's a really good point and question. We definitely are having some of that. Everyone would like me to wave a magic wand and say, we can all go back to the way it was before because you're 2 weeks post your second vaccine. Unfortunately, we can't do that, but we are transitioning people back into the office environment in our administrative offices. Of course, people out in our programs have been out there all along. And we're doing that in a very, planned way. And so that we're alternating days, getting people used to coming back in. Some people are going to stay with the hybrid model. I know more recently, we had to update our travel advisory policy to say in conjunction with what the state of Connecticut is now. It's guidance, it's not requirement, but we're still very conservative. So we're still requiring that people get tested out should they travel out of state. And I did get some pushback from that. I've been vaccinated, what's the point? And I'm like, we still have to be cautious. We don't know where this is going. And I actually have a question for Dr. Choi in line with this, in that we're hearing that you can plan on people being safe or immune if they've been fully vaccinated 2 weeks out for 90 days. Do you think we're going to be hearing an extension of that, Dr. Choi, as far as it will be for more months after you've been fully vaccinated versus just the 90 days?
Oh, yes. So I think the 90-day confusion might be around those who've recovered from the infection. And those are consistent with the CDC guidelines that, after an active infection. So if Garrett were to have contracted COVID and recovered for 90 days, we consider those patients immune, and we don't retest those patients, and the reason we would retest them for any reason may be that, they have to come back to the hospital for a procedure, or they're admitted, and want to make sure that we don't place them in a room with other patients, and we don't consider them infectious at all. And then there are patients that have recovered in the hospital from COVID, and we remove them from isolation. But it does appear that the vaccines will likely provide an immunity, at least for a year and hopefully longer. But as you know, the virus was just sequenced a little over a year ago, and the vaccines were just trialed, this past summer. So it's hard to know how long the immunity is going to be from the vaccine, but we're optimistic it'll be at least a year, if not longer.
And that will be important for all of us to know. Thank you, because planning for transitioning back into the office, what we can and cannot do, having a longer, wider window would certainly be helpful with that. So
yep, absolutely.
And Dr. Choi, I know this is still under research, but there is some thought that people may need a booster at some point. And also to your point about children not being vaccinated, we look at the numbers in the US and Connecticut every day. It's daunting when you think about vaccinating the entire world. And so until that happens, we'll still be under the threat of mutations.
Yeah. So, hopefully the trials are going to be completed, in a expeditious and safe, comprehensive manner. As you know, each of the pharmaceuticals are actually doing the phase 1, 2, or 3 trials. Yale is partnering with Moderna to test their vaccine in children as less than 6 months. And that's very exciting for us as well, too. We're hoping to get several thousand children enrolled and studied as well, too. But I think children pose a risk because, they can be silent carriers. They tend not to be symptomatic as adults or older children, adolescents, but they can certainly be vectors for transmission.
And Chris, let me just pick up on a point that Denise had made about changing restrictions within the workplace. And has that come up yet? I'm sure most people are not in the place where Denise is, where they have a high population of vaccinated folks, but there's always a edginess of removing some of the different rules that put in place. You know, are you following CDC? Have you gone out on your own, set some different standard? What are you advising employers as they have their own prohibitions and as they get to these different points of vaccination?
Yeah, I think, Garrett, at this point, we're still advising a pretty conservative approach, following the CDC requirements. You know, here in our office, you know, we take off our masks when we're in our own offices, but if we leave our door, you know, we put on a mask, we sign in. You know, we still have all the policies about, you know, not coming in if you're feeling sick. I don't see that changing anytime soon. You know, I think it's gonna take some time for people to feel comfortable not taking those precautions. So most of our clients are, you know, these are evolving policies for sure. And you know, we're always changing them and amending and supplementing, but those COVID policies, so to speak, are still well in place at this point. I see one, you know, Garrett, just one follow-up to a chat question that sort of builds off the other thing we were talking about. You know, I had mentioned the sign-up list as sort of a not such a good idea, but you know, some folks are, and we're suggesting that you can do an anonymous survey, you know, of your employees as to who intends to get vaccinated. And then, of course, again, you know, the EEOC has specifically said that you can ask on an individualized basis, you know, whether you've been vaccinated, as long as you maintain that confidentially. So you can get a sense of, you know, as Dr. Choi said, you know, you get a pretty good sense of whether you're going to get to that herd immunity number without disclosing anybody's sort of confidential medical information.
Thanks, Chris. We're going to wrap up in just another minute or so and get into our breakout rooms, but give each of the panelists a chance to say a final word. Denise, anything you want to leave us with? Any advice through your experience so far?
Yes, just work with your staff, be supportive, educational, and but I think accountability is also important in what your expectations are. And to Chris's point, remain conservative in your approaches, even with people being vaccinated.
Thanks, Denise. Dr. Choi, and I know you just mentioned to me as well that, you know, we are seeing some plateauing in the numbers. So we're going down significantly in our COVID infection rate for a while, and now it's really started to flatten out over the last week or so.
Yeah, and I know this group is very well informed and educated, but you know, please, as much as possible for your personal circles and family, as well as your professional colleagues, you know, please resist the temptation to let your guard down simply because the numbers saw a drastic drop. Historically, based on many decades and really centuries of epidemiology, when we see these prolonged plateauing curves, that's when we see, you know, new spikes or new waves occurring. And right now, you know, we monitor very closely the wastewater particles that have DNA from coronavirus, and we're seeing those go up. And those have been historically leading indicators for when we see another spike or another uptick. So we're seeing that in the wastewater, and I want to urge everyone to do their part in sharing with their circle of contacts to make sure everyone continues wearing their masks and social distancing.
Thanks, Dr. Choi. Very important words. And Chris, give you an opportunity to leave us with some final thoughts as well.
Yeah, thanks, Garrett. I would say, you know, the pre-planning, education, and dialoguing with your employees. I mean, it's not only legally required, but it's just practically makes sense. And, you know, at the end of the day, the more you talk, the more you try to understand what their position is or their opinion, and we'll try to work through these things, the better. And it's also going to give the company some legal protection at the end of the day if you have to make a decision on, you know, an adverse employment action or something like that.
Great. Well, thank you, Denise, Chris, Dr. Choi. That's great information. Appreciate everyone who came in today. And we're not done yet. We're now going to move to our breakout rooms. This is how we do our councils and conversations in the pandemic online, still creating those opportunities for folks to network. So I'm going to let Tamika hit the breakout room button, and in a moment, everyone will be transported to a separate room. So thanks again for joining us, and we'll close out from our breakout rooms this morning. All right. Okay, we're gonna leave in like 15 minutes, okay? Yes.